So I'll just briefly explain to you here. It's essentially moving the top and or the bottom jaw to achieve a better aesthetics to the face and a better bite. So it could be that your teeth don't completely close, or your front jaw is on top of is in front of your top jaw or behind it. Now, these cases are approached in a multidisciplinary way, in that they could involve a dentist, an orthodontist, a surgeon, a psychologist. So there can, it's not even a new buzzword anymore, but multidisciplinary team. And they should, all these cases should go through multidisciplinary team meetings to discuss each individual case with the patient. Now, the cases I've dealt with have all centered around patient dissatisfaction with the treatment they've had and poor communication. And that's always a risk, isn't it, when you're involving lots of people and not managing the patient's expectations. The sources of litigation can come from major complications. Now, the majority of these patients are young, fit and well, so you're not going to get that mortality picture with more complex surgery. This is all about morbidity, which is, so one current claim I'm dealing with at the moment is surgery that involved essentially in this surgery you have to divide the jaw, and basically there was an unfavorable break in the jaw for lots of reasons. But the claims can center around poor aesthetics. When you move the top jaw, you can influence the appearance of the nose. I've dealt with cases where that hasn't been addressed and the patients woke up with a bent nose or the nose being of different shape. Their bite could be abnormal and not what they expected it to be following surgery. And that could be part of the plan for surgery to be corrected with orthodontics down the line. But the most common is nerve damage. Again, it's that nerve that I showed earlier on with the x-ray that runs through the jaw. That could be damaged, leaving with permanent numbness. Temporomandibular joint or jaw joint issues, as I alluded to in the last slide, because you're moving the jaws forward and back. So these things need to be identified and patient risk stratified before facial disproportion surgery, because if they're at high risk, they need to appropriately be counseled that surgery may not relieve the pre-existing symptoms. And another growing field is obstructive sleep apnea. So I dealt with a case where a gentleman was a train driver, and essentially on a lucrative salary, but he was stopped because he had daytime somnolence. And he found that he had poor sleep, obstructive sleep apnea, so underwent surgery to move the jaws forward to open up the airways. Well, unfortunately, that didn't improve his sleep. And he never went back to his lucrative job, so he essentially followed the litigation path to say, well, the treatment had not delivered what it was meant to do. So you just got to be a bit careful with what the patients are expecting and the communications around that.